What if I told you that right now, today, there is a bill sitting in Congress that could change the life of nearly every American family with an aging parent, and almost nobody is talking about it? If you have ever watched someone you love slowly lose their independence, if you have ever done the math on home care and felt your stomach drop, if you have ever wondered how you are supposed to keep working a full-time job while also being a nurse, a cook, and a caregiver for your mother or father, this video is for you. Because for the first time in the 60-year history of Medicare, lawmakers have introduced a bill that would actually pay for long-term care at home, not just a few weeks after surgery, not just if you happen to qualify for a narrow window of skilled nursing, real, ongoing, in-home support. Stay with me because by the end of this video you are going to understand exactly what this bill does, who is behind it, what it means for your family, and what you need to do right now if you want to see it pass. Let's start with a number that should stop you in your tracks. More than 10 million people on Medicare right now need help with basic daily activities: getting dressed, bathing, making a meal, getting to the bathroom safely in the middle of the night. These are not exotic medical procedures. These are the ordinary tasks of being a human being, and for over 10 million Americans, doing them alone is no longer safe or possible. And yet, here is the part that shocks most people the first time they hear it. Medicare, the program most Americans assume will take care of them in old age, does not cover this kind of help. Not in any meaningful, ongoing way. Medicare will pay for a nurse to visit you after you leave the hospital. It will pay for physical therapy for a limited stretch of time if you are homebound and under a doctor's care. But the moment your need becomes long-term, the moment it becomes about daily custodial care rather than short-term skilled treatment, Medicare closes the door. And that gap, that one gap in the system, is quietly destroying the finances of millions of families across this country. Think about what that actually means in practice. If your parent needs a home health aide for a few hours a day, every single day, to help them live safely in the house they raised you in, you are looking at a bill that can run past $60,000 a year, paid entirely out of pocket. $60,000. That is more than the median household income in most states. And most families do not have that kind of money sitting around. So what happens? Families do one of a few things, and none of them are good. Some drain their retirement savings, spending down the very nest egg they spent 40 years building, just to get their parents' care needs met. Others spend down deliberately until they become poor enough on paper to qualify for Medicaid, a program that was designed as a safety net for the poor, not as the default plan for the middle class in old age. And an enormous number of families do neither of those things. Instead, a son or a daughter, usually a daughter, quietly steps back from their career, cuts their hours, or leaves the workforce entirely, becoming an unpaid, untrained, exhausted caregiver almost overnight. Right now, family caregivers across the United States are providing more than $1 trillion a year in unpaid labor. $1 trillion. That is not a typo. That is the value of the care being provided for free by sons and daughters and spouses and siblings, propping up a system that was never built to support them, and receiving nothing in return except exhaustion, lost income, and in many cases their own declining health. This is the crisis that has been sitting quietly underneath American life for years, the one nobody puts on a campaign poster because it does not fit neatly into a soundbite. But now, something has actually happened. On August 5, 2026, Senator Andy Kim of New Jersey introduced a bill in the Senate called the Medicare at Home Act. Just days later, Representative Debbie Dingell of Michigan introduced companion legislation in the House. This is what is known as bicameral legislation, meaning it is moving in both chambers of Congress at the same time, which is often a sign that lawmakers are serious about trying to build momentum. So what does this bill actually do? At its core, the Medicare at Home Act would amend the law that created Medicare in the first place to establish something that has never existed before, a dedicated Medicare home care benefit. It would expand coverage under Medicare Part B, the part of Medicare that normally handles doctor visits and everyday outpatient medical care, to also include in-home support for people who need help with daily living. The goal, in the words of the people who wrote it, is to let older adults and people with disabilities remain safely in their own homes and communities instead of being forced into a nursing facility or forced to spend themselves into poverty just to get help. It is important to be precise here, because a lot of headlines are going to get this wrong, and I want you to walk away from this video actually understanding the details instead of just repeating something you half remember. This bill, as it currently exists, is being described by the people who wrote it as a modest, capped benefit. That means it is not a blank check for unlimited in-home care. It is designed as a starting point, a foundational benefit that fills part of the gap rather than the entire gap, while still representing the single biggest structural change to how Medicare treats long-term care since the program was created back in the 1960s. Supporters argue that even a capped benefit would be transformative, because right now the number families are working with is not a cap, it is zero. Going from zero coverage to any meaningful coverage would be one of the largest wins for aging Americans in a generation. Let's talk about who is actually behind this, because it matters. This is not some fringe idea from a single lawmaker with no support. Advocacy organizations that spend every single day working with families in exactly this situation have already come out in favor of it. Caring Across Generations, an organization built around exactly this issue, has pointed out that Medicare simply does not provide a comprehensive, accessible home care benefit right now, and that as a result, far too many older adults are forced to spend down their life savings and fall into poverty just to access the most basic, essential care. Justice in Aging, another major advocacy group focused on older Americans, has said this bill would let people get help with the tasks of daily living before they hit financial catastrophe, allowing them to age with the dignity and independence they deserve rather than being forced to become poor first. When you have policy advocates, elder law experts, and caregiving organizations all pointing at the same gap and saying, "This is the fix," that tells you something. This is not a talking point invented for a headline. This is a response to a problem that people who work in this field see up close every single day. Now, I want to be honest with you about where this bill actually stands right now, because you deserve the real picture, not a false promise. As of today, this is a newly introduced bill. It is in the very first stage of the legislative process. That means it still needs to go through committee review in both the House and the Senate, where lawmakers will debate it, potentially change it, and vote on whether to send it forward. After that, if it survives committee, it would need to pass a full vote in the House, a full vote in the Senate, and then be signed into law. That is a long road, and plenty of bills with strong public support never make it all the way there. So no, as of the moment I am recording this, the Medicare at Home Act is not law. Your parent cannot walk into a Medicare office tomorrow and sign up for this benefit. But here is why this moment still matters enormously. Big structural changes to programs like Medicare almost never happen quietly. They happen because enough public attention and enough public pressure builds up that lawmakers feel like they cannot ignore it anymore. The introduction of this bill is the opening move, not the final outcome. And the truth is, the outcome depends partly on people like you. People watching this video right now actually knowing this bill exists. Think about how many major pieces of legislation over the years started exactly like this, as a bill introduced by a handful of members of Congress that most Americans had never heard of, until enough attention and enough pressure turned it into something that could not be ignored. That is the stage we are at right now with the Medicare at Home Act. It is early, it is fragile, and it is also, genuinely, one of the most significant attempts in decades to fix a problem that has quietly wrecked the finances and the mental health of millions of caregiving families across this country. So what should you actually do with this information? First, understand your own situation. If you are currently caring for a parent or a loved one, or if you can see that day coming in the next few years, this bill is worth watching closely, because if it moves forward, it could directly change what kind of financial planning and care planning makes sense for your family. Second, if this issue matters to you, and I suspect if you have watched this far into the video, it does, the single most effective thing you can do is contact your own senators and your own representative and tell them you support the Medicare at Home Act. Lawmakers pay attention to volume. A bill that gets flooded with calls and messages from constituents moves differently through Congress than a bill that sits quietly with almost no public reaction. You do not need to be an expert on healthcare policy to make that call. You just need to say, I am your constituent, I care about this issue, and I want you to support the Medicare at Home Act. That is it. That is the whole ask. Third, and this is honestly one of the most powerful things you can do, talk about this. Send this video to your siblings. Send it to the group chat with your family who has been quietly stressed about how to handle mom or dad's care as they get older. Send it to a friend who just told you they are thinking about cutting back their hours at work to take care of a parent. The reason issues like this stay invisible for so long is not because people do not care. It is because most families are dealing with this crisis in total isolation, assuming it is just their personal bad luck, not realizing millions of other households are living through the exact same nightmare at the exact same time. The moment people realize this is a shared structural problem rather than an individual failure, that is the moment real pressure for change starts to build. I want to leave you with this. For decades, the story of getting older in America has quietly included an unspoken rule that families were expected to just figure it out. Sell the house if you have to. Drain the savings if you have to. Quit the job if you have to. Just figure it out. The Medicare at Home Act is the first serious bicameral attempt in a long time to say that maybe families should not have to figure it out entirely on their own. That maybe the program millions of Americans pay into their entire working lives should actually be there for them when the need is not a hospital stay, but simply getting older. Whether this bill becomes law depends on what happens over the coming months, in committee rooms and in floor votes, and yes, in how loudly the public speaks up about it. I will be tracking this bill closely, and I will bring you updates the moment anything meaningful changes, whether that is progress in committee, opposition forming, or amendments that change what the bill actually covers. So if this is the kind of story you want to stay informed on, if you want to actually understand the policy changes that are going to shape how you or your parents grow older in this country, you need to make sure you do not miss the next update. If this video opened your eyes to something you did not know was happening in Congress right now, do not let it end here. Hit that subscribe button and turn on notifications, because I am tracking bills like this one every single week, the ones that barely make the news but could completely reshape your family's financial future. This channel exists to cut through the noise and hand you the real, accurate story before it becomes a headline everyone else is scrambling to understand. I am not here to guess or speculate. I dig into the actual bill text, the actual sponsors, and the actual odds of something like this passing, so you walk away knowing exactly where things stand. If you found this valuable, drop a comment and tell me if you or someone you love is dealing with the caregiving gap this bill is trying to fix, because I read every single one, and it genuinely shapes what I cover next. Subscribing costs you nothing, but it means you will be the first to know the moment the Medicare at Home Act moves forward, stalls out, or changes shape in Congress. Join me, hit subscribe, and let's stay ahead of the stories that actually affect your life.